Thank you, everyone, for joining us for this special Contact7 Town Hall with Denver Mayor Michael Hancock. I'm Ann Trujillo. Glad you are joining us. We have assembled a team who can answer your questions. Hopefully, we'll get to all of them. We are joined today by Dr. Robin Wittenstein, Chief Executive Officer of Denver Health, also Bob McDonald, the Department of Public Health and Environment. So thank you, first of all, for taking the time to answer these very important questions for our viewers. We have our very first question is for the mayor, and this came into us from our coronavirus hotline. So let's take a listen.
Yes, question about the masks that was issued today. Is it the law that we have to wear the masks outside of our house? Thank you.
Great question. And actually, no, it's not a law. The governor today made a very, very strong recommendation to all of us that if you leave your home for essential, errands that we have to run, whether it's the grocery store, to the pharmacy, for example, that we wear the mask. And he made a point of once again, as he has always done, so well demonstrating to us how this virus is transmitted. And so his recommendation, strong recommendation to all of us, is to wear the mask. And I got my mask ready to go, by the way, and encourage us to do that if we have to go outside our homes.
And Dr. Wittenstein or Bob McDonald, whichever wants to answer this, how really effective are these masks, even if they're made at home?
Well, thank you. Go ahead, Robin.
I was going to say, I think the mask can provide protection. It is certainly the virus is spread through respiratory droplets, so having the mask on protects other people that you may interact with, and the more of us who are wearing masks, the greater the chance of protecting and spreading the virus. So it really can be very helpful in breaking the chain of transmission.
Okay, our next question came as part of a Zoom conversation that I had earlier with some Denver 7 viewers. This one is for Mayor Hancock. Take a listen.
Our question is actually related. It's about unemployment. So we are part of the restaurant industry that obviously has been closed for a while. And the layoffs that happened with that. I think it's been 2.5, 3 weeks, almost 3 weeks maybe. And so with the process for unemployment, obviously they're really overwhelmed. So we were just wondering kind of what people can expect from that and how long people can expect to wait and what sort of the back pay situation is, like by the time they've processed your application, how far back they pay and if they just send that out. I know they're overwhelmed, so we've just had a hard time getting that information.
Yeah, I've heard of some of the very challenging and frustrating stories trying to get onto the website with the Colorado Department of Labor, but we encourage people to keep trying and to keep doing what you can to try to complete that application process. Usually takes about 3 weeks before the benefits kick in and you receive your first check. One of the things that we all know is that the congressional act that just passed Congress, the $2.9 trillion, includes a bump in weekly benefits to those who are applying for unemployment, as well as picking up contract and part-time and independent contractors, making them eligible for unemployment benefits as well. So we encourage folks to keep trying. Again, once you apply, it takes anywhere from 2 to 3 weeks, maybe even longer now, unfortunately. Maybe up to as many as 6 weeks before benefits actually kick in, but it's important to keep trying. And they also have a schedule on the the Colorado Department of Labor's website as to your name, your last name, and when you should go and apply.
And I think the issue here is that people are just frustrated because they need the money now.
Absolutely. We certainly understand that, Ann. And that's
how do we make sure that it's timely and what is Denver doing where people can get some benefits right now?
Yeah, those are unemployment benefits that are within the state, and we certainly urge folks to do that. If you are a resident of the city of Denver, which I can speak to, we do have a couple of programs available. One is the TRUA program, or better known as a temporary rental utility assistance program, that does provide some support for folks who have fallen behind on their rents or mortgages. And we encourage you to call 311 and push the option 6. That allow you to begin the process of applying. Again, you must be a Denver resident. You must have evidence that you're a Denver resident, and you must have a notice from your landlord or from your mortgage company that you're behind, so we can provide some form of assistance as long as those resources continue to last.
Okay, this next question also came through a Zoom call, and this relates to the overall response. Have a listen.
The whole situation with the pandemic is kind of frustrating that all the states aren't on the same page. There doesn't seem to be like an overall plan or guideline, that all the states should be following. It seems like some states, golf courses are open. Some states may have hair salons open. And it just sends mixed messages that says, well, if it's okay for these people to be doing it, we should be doing it. And it just seems like there's not enough authority, or guidelines telling people, exactly what they should or should not be doing.
Bob McDonald, we'll let you take that one.
Yeah, I appreciate your question. I think this is certainly an unprecedented situation that we're in here. And I think the first thing I'd offer is that 90% of the country is under a stay-at-home order right now. There are some nuances, of course, state by state and community by community. I think the mayor and the governor have been leaders in terms of implementing some of the things that have been done in our communities to stem the tide here with the spread of this disease. Communities are going to do what they feel is best for them. There are no easy answers here, but I do believe in many ways Denver's stepped out in front with the education that's been done with our communities. We've stepped it up, ramped it up appropriately. With every decision that's made, there's an impact. There's an economic impact, and we could create other public health impacts if we make decisions too soon. So I appreciate your question. I think Denver's been out in front. It's been a leader. And we're going to continue to do what's best for Denver and stay aligned with the governor.
But how do you handle enforcement in what seems to be, some businesses are open, some businesses aren't, and people have a lot of questions about being forced to work as well under these conditions without some, even masks in a lot of cases?
Well, personal protective equipment has been a challenge for sure. We have placed an order for hundreds of thousands of pieces of various types of protective equipment, and businesses are divided up into non-essential and essential. And in terms of the enforcement, we have many employees, many city employees, not just in the Department of Public Health and Environment, but many partnering agencies throughout the city that are walking through the community, driving through the community, making sure that everyone is in compliance. And I really want to thank those businesses that are complying and all citizens who are complying. In my mind, this is one of the most important phases of controlling this, to stem the tide of this outbreak, to flatten that curve that has been referred to so many times. And we have numerous employees out conducting enforcement to make sure there is compliance. And by and large, there's a great deal of compliance.
And what does that enforcement mean? I mean, what are you doing? How are you cracking down?
Well, with any public health enforcement, there's the first thing that takes place is education. We've done a great deal of education long before we even had our first case. We saw this coming. We reached out to regulated facilities, the community, persons experiencing homelessness, to do everything we can to educate them about what was coming. Then as the orders were ramped up, again, more education takes place, but we never conduct enforcement without that education piece and without a warning. And again, we're seeing a great deal of compliance. We have had to conduct some enforcement, but it's important for everybody to comply with this.
And I guess my question is, Mr. Mayor, I'll ask you then, because I think people are just frustrated by the people they see out and about who are not following the rules.
Yeah, this is uncharted territory for all of us, government, individuals, families. And we had to expect that there were going to be some companies and individuals who are going to be slow to take it. It's one of the reasons why we're going to have to extend the stay-at-home order until April 30th, because it takes a while for people to get into the practice of staying at home and exercising physical distancing. But you're absolutely right. It's frustrating. And we hear a lot of folks, they call 311. Some have called the non-emergency police line. They've called 911. to let us know, and we try to get out and investigate those as much as possible. But let me say this, that those companies that we've had to move in on, yesterday we had to chain the door of one of the companies. It's only after, as Bob pointed out, numerous efforts to contact, have conversation, educate and discourage the action that we ultimately move in. And we cannot have people take these orders for a joke, because if that happens, if we allow the lax enforcement or lax attitude toward them, then we'll never get over the other side of this curve.
Dr. Wittenstein, let me bring you into this conversation. We have heard the governor say the next 2 weeks are going to be hard. They're going to be even worse. And so what are we doing? Are there makeshift hospitals in the works? Are we going to see the convention center being taken over at some point? What do you see ahead?
So the healthcare industry is really preparing as best as we possibly can. I think, as Bob said, this is unprecedented. We've never seen a situation like this. And in particular, disasters have occurred in our country, but we've never had a disaster that has engulfed the entire world. But that being said, I can tell you that in numerous conversations with my CEO colleagues across the region, in conversations with the mayor and with the governor, every single hospital is preparing. They're increasing the number of ICU beds they have available, looking at ways that we can increase the capacity for medical surgical patients. So patients who are lower acuity but still need to be in hospital. We're working with our partners in the skilled nursing facilities and other post-acute facilities so that we can place patients into them as quickly as possible and move along. And most importantly, we are asking everyone, please stay at home. We have switched to almost all telemedicine visits for our outpatient clinics. We don't want people to be exposed or take the chance to be exposed by coming into a healthcare facility. So all of the hospitals in the region are switching to conducting as much as possible care in the home or in outside of the hospital environment.
So will we see makeshift hospitals set up in Denver proper?
It is entirely possible that we will. We do expect the next few weeks are going to get to be much more difficult. The number of cases has been increasing, although Denver, the city of Denver and the state of Colorado have actually done a really good job in getting ahead of the curve in terms of the stay at home and social distancing. So that has had an impact on the number of cases, but we will see the number of cases increase. And I do think that we will find the hospitals being particularly stressed over the next 2 to 4 weeks, with the potential for a need for a facility at the convention center to take some of the patients who no longer need to be in a hospital but are not quite ready to go home.
All right, this next question comes to us by way of email. This is from Sylvia, and Sylvia writes, could you please tell me why gun stores are allowed to remain open and why are they considered an essential business?
You know, the initial order that the public health order that was issued under Bob's leadership that I supported as the mayor it excluded gun shops as essential business. And actually, we were in the middle of a legal issue in the court at the time that the governor issued his order and named gun shops as essential business. And so as we adopted the governor's order, we, of course, included gun shops as part of that effort. So this is one of the things that Bob talked about and I think was alluded to in the first question that you mentioned, and with regards to kind of the difference in interpretations, difference in what is essential, not essential. Sometimes it happens, and we follow the governor's order that gun shops were essential, and so that's what they are under these orders today.
Is there frustration? I know we talked about this earlier, that not everyone is following the same order. Is that tough for a city?
You know, it is. I don't know if frustrating is the word. It's uncharted territory for us across this land. This is where national leadership is so paramount, and I can't underscore that enough. But I got to tell you, I talk to the governor just about on a daily basis where we're comparing notes, we're comparing our implementations. There are conference calls daily, though we may be working remotely from home. I got to tell you, I have it on at minimum 12 to 14 conference calls a day, and they include elected leaders all across the state of Colorado. Many of us come from different types of governance structures, and we have to align those somehow. We have to find a way to reconcile it with our orders and with our practices. That's challenging, but I got to tell you, there is a great deal of resolve and commitment and tenacity on behalf of everybody involved to try to get aligned and to make sure we make this work for all of us across the state of Colorado.
All right, our next question touches on a similar theme of employment. It comes to us via the Denver 7 voicemail line. I think we have it. All right, sorry, we're going to get to that. Well, actually, I'll just read it to you because this person is asking, why is it that liquor stores and pot stores get to remain open? This person writes, I find that to be confusing. And secondly, are the Denver public golf courses going to reopen?
Man, did they see the lines that occurred for the 3 hours? I saw a T-shirt not too long ago. Someone sent me a T-shirt that was selling online that said, I survived the 3-hour prohibition in Denver. And you know what? There was some miscommunication in our crash room, if you will, as in terms of whether or not liquor stores and recreational marijuana outlets would be allowed to be open. There are medical reasons why even the liquor stores and marijuana retailers would be allowed to be open. And the fact that people are going to be staying at home, you know, people understood that this is important to our own entertainment privately at home, whether it's the marijuana retailers or the alcohol. So we understood that. Once we got over the hump of miscommunication, we cleared it up. But I think the lines that formed kind of very clearly told us how important people saw the importance of being able to be with their families, with their proper sustenance, if you will, from the retailers.
But seriously, Dr. Wittenstein, from a medical perspective, is that an essential business?
Actually, surprisingly, it is. So people who are alcoholics who are used to drinking a significant amount of alcohol each day, if they all of a sudden were no longer able to get the alcohol, could go into withdrawal. And one of the challenges is with our expectations of the volumes of patients who are going to be affected by COVID, the last thing that we wanted to do was have the emergency rooms also then swamped with people who were going through withdrawal. So as odd as it may sound, in this particular instance, having access to alcohol actually remains a medical necessity.
And I think the other issue that people have raised is the social distancing. So, Mr. McDonald, how do you manage all of that when, yes, we're talking about a pot shop or a liquor store and people are not maintaining that social distancing?
Well, it certainly is a challenge. You know, this is a time where every citizen needs to kick in here. Every citizen needs to do the right thing. As I said earlier, we have a lot of staff members monitoring these various venues. We are responding to concerns that call in immediately. As soon as they're called in to 311, we respond immediately. But it is a challenge. That's why we need everybody, every citizen to step up at this phase in managing this outbreak.
All right, this next question just came in from Katrina, who was watching on Facebook Live, and she writes, I work for myself doing house cleaning and pet sitting. I only work a couple of days a week and don't make much money, but now I'm not making any. Would I qualify for any assistance?
I would recommend that she apply for unemployment. Again, the new federal guidelines allows for contract and independent contractors to be eligible for unemployment. Have your documents ready. Have your if you've applied for taxes or at least filed your taxes over the last couple of years, that will also be helpful. But the new laws do encourage people who are independent contractors and self-employed to apply for unemployment benefits.
Except that, again, people need money right now.
No, absolutely. And again, the programs that are in the city of Denver, for example, the TRUA support, again, those benefits are there. A lot of folks are calling in on them. We recommend that they certainly apply for those by calling 311, pressing the number 6. But also, if she's an independent contractor with her own small business, we also have an effort in our Division of Economic Development and Opportunity where we're providing some grants to small business owners, and she would fall under that category. And we recommend that she call 311 or go to the denvergov.org website.
What about our first responders? How are we protecting our Denver firefighters and our Denver police officers?
And I missed that question. Try it again. You broke up.
How are we protecting our first responders?
Oh, I appreciate that, Ann. I've had a chance to talk to the chiefs of both of all of our first responders, and I'm sure Dr. Wittenstein would love to respond regarding the paramedics. But we had some limited PPE for them, some personal protective equipment. They are first in line when it comes to that equipment coming into the city of Denver. Our first responders, our paramedics, our firefighters, our police department. And while we're at it, we want to send a shout out and a very special public thank you to I2 Corporation, who supplied 2,500 test kits for our first responders, our safety department in the city of Denver yesterday. That is a Denver-based company. The CEO lives in Lowry, and they provided these test kits to our safety department free of charge yesterday, and we want to send a great deal of gratitude to them as well. Dr. Wittenstein, you want to comment about the paramedics?
Yeah, I would say that we recognize that having the paramedics out on the street, being able to help people in need is really critical. We obviously are providing the appropriate PPE to them. We're also, we've been doing testing in-house at Denver Health now for a few weeks. Our healthcare workers, including the paramedics and patients who are in-house, have been the top priority. But immediately after we were able to increase the number of tests that we could do, the city's first responders, police, sheriffs, firefighters, and 911 dispatchers were next on the list for us to get to. They are critical partners to our paramedics in being able to take care of the residents of the city. And we are all deeply committed to making sure that they are as safe as they possibly can be.
What else are you hearing from our medical community, Dr. Wittenstein, about their frustrations? I mean, do they have enough? Are we doing enough for them?
Again, this is a situation that we've never faced before, and there have been a lot of concerns and fears about what's going on, about the risks that healthcare workers take when they walk into a room and they either don't know the status of the patient or they know that they are a positive. The fear that they could bring the infection home to their families. We are doing everything we possibly can to make sure that our staff has the protective equipment that they need in order to be safe. All of our caregivers are masked when they are interacting with patients. If we've got a patient and we have to do a procedure that would increase the risk, they're getting the appropriate N95 mask. I will also say, though, that this is extremely stressful. And we are working to provide not only the equipment and the protective gear that the staff needs, but also to try to help them feel safer and deal with some of the psychological stress that they're under. It will only get worse, and we know that. The nurses, the doctors, not only here, but at every healthcare facility in the state, in the country, are deeply committed to taking care of the patients that they are taking care of. We're looking at programs that can help support the emotional and psychological stress that they're dealing with. We have a program here at Denver Health called RISE, which is intended to help healthcare workers deal with stressful situations, and we're expanding that significantly. I will also say that the community has been amazing. The outreach from individuals, from companies offering support and thanks, but also offering food to healthcare workers, donations of PPE that they've been able to find has been truly remarkable. We have donations coming into the institution to help pay for services for our patients, for our workers. The way that the community has rallied around the needs of the people who are both suffering from the infection, but also taking care of those who have, whether they're healthcare workers or first responders, as the mayor suggested, has really been incredible. And so while there may be some frustration with some people who don't follow all of the rules, I think we can be proud of the response that the majority of people are making.
And can I announce something
Of course.
here? We've had some conversation about men and women all over this nation, like our first responders that Dr. Wittenstein just talked about, our firefighters, police officers, our paramedics, our doctors, our nurses, our physician assistants, but also our grocery store workers, our retailers who are still on post and taking care of us. We've been trying to figure out a way to celebrate them. All over the world, we're seeing people on their balconies, front porches celebrating first responders. What we're deciding to do on April the 9th, the city of Denver, and I'm announcing here for the first time, we're going to illuminate our city and county building in red and white in honor of all of the men and women who are standing on the front lines to take care of us during this time. While the rest of us have been ordered home, they're still showing up at work taking care of us. And we're going to encourage, and this came from a great idea from Councilwoman Kendra Black in Southeast Denver, She said, why don't we encourage people to put their lights back on their trees on the outside if they have them, as a symbol of saying thank you to our men and women who are still on post, whether they're first responders or medical professionals, or people in the grocery store who are there to take care of us, waiting to take care of us when we walk through those doors. And so we're going to begin that on April 9th. We're going to have a formal announcement, but you just got it here live on Channel 7.
Thank you. Thank you for that. I think one of the other issues that we're seeing through Facebook Live, the concept of freezing rent, is that a possibility? I mean, seriously, that is overwhelmingly what people care about right now. Again, they don't have paychecks. Their rent has been due for the last couple of days. Mm-hmm. And a lot of people out there haven't been paid for the last few weeks.
Yeah, it's not something that as a city we have the authority to do. And I'm not quite sure even if the governor has the ability to do that. But what we're doing is we're appealing to, of course, the consciousness of our banking industry to work with borrowers or mortgage holders and ultimately landlords that lead also to breaks for renters. I was just talking with my daughter who rents up at CSU, rents an apartment there. And, we pay her rent. But the reality is that there are a lot of college students who are working in their student jobs to pay their rent. And what happens to them? Right. Well, the apartment companies weren't giving any breaks to them, except for maybe delaying it without fines or fees down the road. But yeah, it is appealing to the banking community, many who are stepping up, and the mortgage companies that give folks a break. And ultimately, that should lead to the renters. But we don't have the authority in Denver to do that.
Well, and Robin and Bob, please jump in at any time. But I have not seen to date any official, and I'm not talking just Denver, but any official put pressure on the mortgage companies to say, hey, let's let you postpone your payment for 2 months and then we'll pick it up on the back end. Or we hear messages to landlords, but oftentimes landlords, are, regular folks who can't afford to do that either.
Yeah, absolutely. Listen, we have done, one of the first things that we did as part of our public health order was to I forbid the sheriffs from participating in evictions. So we redeployed our sheriffs to what we consider more important issues today. But it did not let off the hook, landlords or the bank industry. There are some governors across the nation who have found it in their authority to freeze collections and mortgages. I don't know if Colorado has that within its constitution and given the governor the power, so I can't speak to it. But it is something that clearly needs to happen to help people who are renting, but also people who have mortgages who find themselves out of work today as a result of our responses to COVID-19.
What else is out there that you're hearing from people that are needs right now that maybe we as a community can address?
Well, obviously, we are still, we're hearing a lot from people who are struggling and financially. And the young lady who works in a restaurant, our restaurant entertainment industry has been devastated by the shutdowns. And I want her to know, and I want all the workers to know that this is top priority for us. There is nothing that trumps, other than, of course, making sure people are healthy and safe from further spread of the virus. Trumps our efforts and our desire to get back to work and to help people get through this very difficult time. That's why we spend as much time working on the Washington bill, and we're spending time talking to the governor and doing what we can to cobble support here at the local level. But we think about all our workers every day and knowing this is a very difficult time. But we really encourage folks to take the time to apply for their unemployment benefits. People need money today. If you live in the city of Denver, take a look at the resources we have available on our website at denvergov.org under our COVID section, but also under our Economic Development Office.
Let me ask you a question about DIA. Is it safe to travel? I mean, people are still landing on flights and coming to Colorado. Why is DIA still open and is it safe?
All the airports are still open, and as long as airlines are still flying, we have a requirement under the law to remain open. Federal law requires us to remain open. I can tell you the passenger volume at Denver International Airport is down 90%.
Right.
So there's almost no one going through the airport. If you had flights booked for April, the airlines are just proactively canceling those flights today. And we have concessionaires that have closed because it was less expensive to close than to remain open at the airport. We are following CDC guidelines, and we are sanitizing the airport at a level that is much greater than it was prior to COVID-19.
Dr. Wittenstein, let me ask you this question. People want to know, is it safe to get takeout food? They're concerned about the virus living on surfaces, or maybe Bob, one of you two or both of you jump in there.
Sure, I'd be happy to answer that. We've had a lot of questions about, is this coronavirus, can you catch it from pets? Is it passed through food? What about blood and blood donations? We're at a critical point with that as well. There's no literature, there's no article to suggest that any of that would occur, that this virus would be spread through any of those things. It can be spread on surfaces, but we have a great deal of compliance with our hospitality industry here in Denver. And if they're following the measures that they should be following every day, there's very little risk with ordering takeout.
And I would add, when you do get takeout, when you bring the packages into your home, make sure that you're cleaning the surfaces that you're putting them on. Washing your hands really and truly is one of the best things that you can do, as simple as it sounds, but it really can protect you. So making sure you're washing when you go in and out is important too.
And should we be expecting those workers, those restaurant workers, to be wearing gloves and masks while they're preparing our food?
Well, I'll answer that. The food safety regulations for the city of Denver and the state is consistent with this. Food safety workers shouldn't be having direct hand contact with food anyways, even in the absence of this pandemic. So that shouldn't be occurring. And in terms of wearing masks, we've addressed that earlier. We would encourage everyone, even in a work setting, to be wearing masks, as the governor announced today.
So we should not go into those restaurants if we see them not wearing protective gear?
No, absolutely not. I think, well, again, if they're not wearing gloves, they should be. And if that concern was called into our staff, we would respond to that immediately. If they weren't wearing masks, if there was a concern with that, we'd certainly follow up with that too. But it is not a regulation at this point. It's strongly encouraged.
An essential worker is asking what their employer should do, I should say, if a coworker tests positive. Should that facility be closed?
No. That's we've had a lot of that. Unfortunately, some overreaction along those lines, and I understand that people are concerned, they're confused. When there is a positive test, that information is given to the Department of Public Health and our partners at Denver Health and Hospital Authority, and we would investigate that. And through that investigation, then we would determine who the close contacts were, what was the nature of that contact, and if isolation or quarantine was needed, then we would make targeted decisions along those lines. But sending everybody home in an office setting or in any of the venues that we discussed simply because somebody tested positive would be an overreaction in many cases.
Mr. Mayor, I'm going to ask you, we have heard some stats that possibly 75% of restaurants are not going to make it. How do we deal with that? I mean, we want our businesses to come back. How do they rebound?
Our goal is to try to get on the other side of this curve as quickly as possible, and obviously the longer this takes for us as a community to flatten the curve, the more in peril our companies become, whether they are restaurants or they're bars or they are nail salons, spas, and barbershops, beauticians. This is a challenge for everyone. And so that's why we took the action as boldly as we could to blunt the curve and to get on the other side of this, to flatten it as quickly as we could, because we know that if we waited any longer, that the pain that we would experience economically, but also physically and socially would be much greater. And so we've taken very bold steps. We're prayerful that ultimately we're able to get on the other side of this quickly enough to save some of these businesses that are struggling.
And has there been any thought into possibly delaying a raise in the minimum wage?
You know what? There are all kinds of discussions, the minimum wage being one of them. Obviously, we are putting together a council of business and economic advisors who are helping to advise me and the city on how to make some of these critical decisions to help jumpstart the economy when we get a chance to do that on the other side of this curve. They're very smart people, and I'm very excited to hear some of their ideas that they have. I got to tell you, that a lot of different ideas are coming to us in terms of how we can help businesses, no matter what size or the type of business industry that they come from.
Let's talk about domestic violence for a moment. How is the city addressing this issue now, knowing that kids aren't going home or not going to school? We don't know what's happening in the home, and we often rely on our educators to be part of that key in helping us stay aware.
Yeah.
How is that being handled now?
Typically, we depend on our teachers, right, and other educators or educational professionals to alert us. If the kids aren't seeing them every day, we may have a challenge, a gap in that opportunity. I just shot a video which really encourages all of us to be aware. Obviously, we're not outside as much, but if we see any signs or suspect anything from a neighbor, a child in the neighborhood, there are numbers that we can call. We'll make sure you get that to post up. But it's very important that we all remain aware. And I'm sure that Bob and Dr. Wittenstein will tell you, this is one of the areas that we're most concerned about. You asked about liquor stores and marijuana places. That was one of the things that we were concerned about as well. When you shut those down, you typically see people don't have access to those things. You typically see an escalation in domestic violence and child abuse as well. So it is important that we think about those things and that we encourage people to call the emergency 911 or non-emergency hotlines when we suspect or if you are a victim of domestic violence.
We have not spoken about the homeless population in Denver. What's happening to address we don't want to see, especially the homeless population, deal with coronavirus. How are we addressing that in Denver?
Well, I'm happy to take that question. As I mentioned earlier, very, very early on, we started in the Department of Public Health, started reaching out to persons experiencing homelessness within our community, educating them that this was coming. We provided maps where hand sinks are located throughout the city as a reminder.
Well, I think we have lost Bob there for a moment.
I can jump in where Bob's going. I'm sure
Okay,
Dr.
great.
can share, but one of the things that we want to do is we've been working hard, and I want to just really thank our service providers and
where those looks at the down partners at Housing Stability.
The goal is to provide alternate shelter opportunities for our homeless. In an unprecedented action, shelter and service providers came together to collaborate, and they called on the city to help them find a place that will allow for us to properly shelter our homeless while at the same time providing physical distancing opportunities. So we've done a couple things. We've worked on a coordinated shelter system. We're also talking to hotels to get some of these rooms that are empty today for our homeless individuals experiencing homelessness. And we do have some rooms today that when an individual who is experiencing homelessness walks into our shelters and they're exhibiting symptoms, we have respite rooms available at the hotels to help them to safely and humanely rest and to get over the whatever they're dealing with, because we don't know what it is. But there is a coordinated effort, and I really want to celebrate those providers, our host, our housing opportunity team that's working around the clock to create these opportunities today.
You're right. There are so many people who are working hard and thinking 24/7 about how we get over this. Let me ask you, Dr. Wittenstein, a question. What about those people who have already had coronavirus, and we see that blood donations are being taken to help create, antibodies or whatever it is? Is that something that Denver Health is looking at as well?
We've had blood drives here, and one of the challenges early on was the concern that with the fears of getting virus, that people were canceling out of blood donations, and so the blood supply in the country was really at risk. So we've actually implemented a number of blood drives here for our own employees, and we'll be reaching out to the community. Other providers are doing similar things. The work is going on now. The scientists and the physicians are studying whether people who have had the virus have had an immune reaction, whether that can be an appropriate treatment. Again, one of the challenges with this virus is that it's brand new. We don't know a lot about it. Every day that goes by, we're learning a little bit more. And I can tell you there is work going on in academic medical centers and in science labs across the country trying to determine what is the best way to treat it, including would antibodies from
Sure.
people's blood be helpful?
And Bob McDonald, let me ask you about childcare centers. I know a lot of people have been concerned about who's staying open, why they're staying open, and it's not necessarily, the essential employees who are taking their kids to these childcare centers. Address that, please.
Yeah, childcare centers are essential. With every decision that we make about closing certain types of facilities, there can be an impact. And one of the things that we thought about was, if we start closing childcare centers, then children could be placed in a situation that might be less safe for them under the care of somebody who may not be trained. So our childcare staff are inspecting those facilities, monitoring those. There are distancing guidelines that we've given those shelters that are open. And so we are monitoring that closely. But you could really have an impact just closing childcare like that, and then less oversight from a regulated entity.
Are there any specific precautions that childcare providers should then be taking?
Well, they should be doing the same things that everyone else is doing as a provider or anyone else in the community, certainly washing their hands. Don't go into the childcare setting to care for kids if they're experiencing symptoms. There are rules and guidelines that we provided in terms of not mixing groups of kids, having smaller groups of kids. So certainly we've provided guidance along those lines, and we continue to monitor compliance with those guidelines.
Okay, so we have about a minute left, and I think everybody wants to know, when will this end? When will we see what looks to be normal? Anyone want to venture a guess?
Well, I can speak to that. I'll be brief here. Certainly, we look at modeling. We're going to be looking at the rate at which cases increase. We want to get over that curve. And then we want to make sure that there is massive testing available so that we can make targeted investigations and isolation orders. That's really what takes the place of a broad isolation or stay-at-home orders, having that infrastructure in place. And we'd be looking at all of that, the capacity of our hospital partners. We would look at all of that before we would lift an order.
Mr. Mayor, I'll let you finish up with that question as we look forward. We have 30 seconds.
Yeah, obviously we look forward to the slowdown and the amount of transmission that's occurring in the community, and our hope and prayers that we get on this very quickly. And I do, again, want to encourage folks, put your Christmas lights back on your trees, and let's illuminate the city, and let's thank everyone who's staying on post in support of us as we all stay at home to try to get over this curve.
We are all looking forward to that. So thank you so much, Dr. Wittenstein, Bob McDonald, Mayor Michael Hancock. Thank you all for joining and participating in this town hall. If you missed anything, you can find it on the Denver 7 Facebook page or on the denverchannel.com. Thank you so much for watching, all of you at home.
Thank you.
Have a good evening.